Elizabeth Warren says on her website that she has a lot of plans, but they're really one simple plan. We need to tackle the corruption in Washington that makes our government work for the wealthy and well-connected, but kicks dirt on everyone else, and put economic and political power back in the hands of the people. That is really great. Still, many wonder how Elizabeth Warren is going to pay for her health care plans. In this video we are going to show according to her website how she intends to pay for her health care plans. Elizabeth Warren clearly states that she will not raise taxes on the middle class to pay for her health care plans. Elizabeth Warren says we don't need to raise taxes on the middle class by 1 penny to finance Medicare for All. On her website she explains how she's going to cover the costs of her health care plan through the following. Medicare for All puts all health care spending on the government's books. But Medicare for All is about the same price as our current path and cheaper over time. That means the debate isn't really about whether the United States should pay more or less. It's about who should pay. Right now, America's total bill for health care is projected to be $52 trillion for the next 10 years. That money will come from 4 places: the federal government, state governments, employers, and individuals who need care. Under my approach to Medicare for All, most of these funding sources will remain the same too. Existing federal spending on Medicare and Medicaid will help fund Medicare for All. Existing state spending on health insurance will continue in the form of payments to Medicare, but states would be better off because they'd have more long-term predictability, and they'd pay less over time because these costs will grow more slowly than they do today. Existing total private sector employer contributions to health insurance will continue in the form of contributions to Medicare, but employers would be better off because under the design of my plan, they'd pay less than they would have otherwise. Here's the main difference: individual health care spending. Over the next 10 years, individuals will spend $11 trillion on health care in the form of premiums, deductibles, co-pays, and out-of-pocket costs. Under my Medicare for All plan, that amount will drop from $11 trillion to practically zero. I asked top experts, Mark Zandi, the chief economist of Moody's Analytics, Betsy Stevenson, the former chief economist for the Obama Labor Department, and Simon Johnson, to examine options for how we can make up that $11 trillion difference. They conclude that it can be done largely with new taxes on financial firms, giant corporations, and the top 1%, and making sure the rich stop evading the taxes we already have. That's right, we don't need to raise taxes on the middle class by 1 penny to finance Medicare for All. Here's how it would work. Replacing employer health spending with a new employer Medicare contribution. Let's start with a basic fact: American companies are already paying a lot for health care for their employees. They are projected to pay nearly $9 trillion over the next 10 years, mostly on employer contributions for employee health insurance and on health-related expenses for employees under workers' compensation and long-term disability. My idea is that instead of these companies sending those payments to private insurance companies, they would send payments to the federal government for Medicare in the form of an employer Medicare contribution. In fact, it'll be a better deal than what they have now. Companies will pay less than they otherwise would have, saving $200 billion over the next 10 years. To calculate their new employer Medicare contribution, employers would determine what they spent on health care over the last few years and divide that by the number of employees of the company in those years to arrive at an average health care cost per employee at the company. Companies would count part-time employees towards the total based on the number of hours they work during a year. Under the first year of Medicare for All, employers would then take that average cost, adjust it upwards to account for the overall increase in national health care spending, and multiply it by their total number of employees that year. Their employer Medicare contribution would be 98% of that amount, ensuring that every company paying for health care today will pay less than they would have if they were still offering their employees comparable private insurance. A similar calculation would apply to pass-through entities, like law firms or private equity funds, even though many of the people that work there technically aren't employees. People who are self-employed would be exempt from making employer Medicare contributions unless they exceed an income threshold. Small businesses, companies with under 50 employees, would be exempt from this requirement too if they aren't paying for employee health care today. When either new or existing firms exceed this employee threshold, we would phase in a requirement that companies make employer Medicare contributions equal to the national average cost of health care per employee for every employee at that company. Merging firms would pay the weighted average cost of health care per employee of the two firms that are merging. Employers currently offering health benefits under a collective bargaining agreement will be able to reduce their employer Medicare contribution if they pass along those savings to workers in the form of increased wages, pensions, or other collectively bargained benefits. New companies or existing companies who enter into a collective bargaining agreement with their employees after the enactment of Medicare for All will be able to reduce their employer Medicare contributions in the same way. Employers can reduce their contribution requirements all the way down to the national average healthcare cost per employee. That way, my plan helps unions that have bargained for good healthcare already, and creates a significant new incentive for unionization generally by making collective bargaining appealing for both workers and employers as a way of potentially reducing the employer's employer Medicare contributions. Over time, an employer's health care cost per employee would be gradually shifted to converge at the average health care cost per employee nationally. That helps make sure the system is fair but also gives employers and employees time to adapt to the new system. If we're falling short of the $8.8 trillion revenue target for the next 10 years, we will make up lost revenue with a supplemental employer Medicare contribution requirement for big companies with extremely high executive compensation and stock buyback rates. There are a variety of ways to structure an employer contribution to Medicare for All. This particular approach has the benefit of helping American employers in a few ways. Employers would collectively save $200 billion over the next 10 years. Employers receive far more certainty about how their health care costs will vary over time and affect their finances. Small businesses, who often suffer when competing for employees because they can't afford to offer health care coverage, would no longer be at a competitive disadvantage against bigger businesses. Employers can reduce their employer Medicare contribution by supporting unionization efforts and negotiating with workers to provide better wages and benefits, reducing costs and promoting collective bargaining at the same time. Because my plan holds healthcare cost growth to GDP levels, businesses will have stable balance sheets that grow with the economy instead of crowding out other priorities. By asking employers to pay a little less than what they are already projected to pay for healthcare, we can get almost halfway to where we need to go to cover the cost of my Medicare for All plan. Automatic increases in take-home pay Medicare for All puts a whole lot of money back in the American people's pockets. One way it does that is by taking the share of premiums employees are responsible for paying through employer-sponsored insurance, that line on pay stubs each week or month that says health insurance, and returning it to working people. Congratulations on the raise. And higher take-home pay for workers also means additional tax revenue just from applying our existing taxes, approximately $1.15 trillion if we apply average effective tax rates. Medicare for All saves people money in other ways too. With Medicare for All, nobody would need to put money in health savings accounts or medical savings accounts to try and protect themselves against the unthinkable. And because individual spending on premiums, deductibles, co-pays, and out-of-pocket costs will basically disappear, the tax break for medical expenses in excess of 10% of adjusted gross income becomes irrelevant. Together, those changes would generate another $250 billion in revenue. All told, another $1.4 trillion in funding for Medicare for All is generated automatically through existing taxes on the enormous amount of money that will now be returned to individuals' pockets from moving to a Medicare for All system with virtually no individual spending on healthcare. Here's what that means: we can generate almost half of what we need to cover Medicare for All just by asking employers to pay slightly less than what they are projected to pay today, and through existing taxes. So where does the rest of the money come from that allows us to eliminate premiums, deductibles, co-pays, and most out-of-pocket spending for every American? 4 sources. 1. Better enforcement of our existing tax laws so we stop letting people evade their tax obligations. 2. Targeted taxes on the financial sector, large corporations, and the top 1% of individuals. 3. My approach to immigration. And 4. Shutting down a slush fund for defense spending, cracking down on tax evasion and fraud. The federal government has a nearly 15% tax gap between what it collects in taxes and what is actually owed because of systematic under-enforcement of our tax laws, tax evasion, and fraud. If that 15% gap persists for the next 10 years, we will collect a whopping $7.7 trillion less in federal taxes than the law requires. By investing in stronger enforcement and adopting best practices on tax reporting, withholding, and filing, experts predict that we can close the tax gap by a third, generating about $2.3 trillion in additional federal revenue without a single new tax. A big part of our current tax gap problem is that we're letting wealthier taxpayers get away with paying less than what they owe. Studies show that the wealthiest 5% of taxpayers misrepresent their income more frequently than the bottom 90%. The wealthy and their allies in Washington have worked to slash the IRS budget, leaving it without the resources it needs. The agency today has about the same number of revenue agents as it did when the economy was 1/7 its current size in the 1950s. And the IRS insists on targeting low-income taxpayers rather than wealthy ones, even though the amount of revenue we can recover from wealthy taxpayers is far more. We know how to fix this problem. We can draw lessons from what works in other countries with much lower tax gaps and rely on the recommendations of tax experts. Here's a game plan: substantially increase funding for the IRS, including the Criminal Investigation Division. The Treasury Department estimated in its fiscal year 2017 budget request that every $1 invested in IRS enforcement brings in nearly $6 in additional revenue, not even including an indirect deterrence effect 3 times that amount. Expand third-party reporting and withholding requirements. Research shows that third-party reporting and withholding cuts down on the tax misreporting rate substantially. Strengthen enforcement of the Foreign Account Tax Compliance Act, FATCA. FATCA requires foreign financial institutions to report the holdings and income of U.S. taxpayers, but the IRS is generally not systematically matching these reports to individual tax returns. We also don't hold foreign financial firms truly accountable for ignoring their reporting obligations. Automatically matching FATCA reports to tax returns and instituting sanctions for non-compliant foreign financial institutions would help narrow the tax gap. Simplify tax filing obligations in line with other comparable countries with lower tax gaps, including by adopting My Tax Filing Simplification Act and using smart returns to improve honest reporting. Redirect enforcement resources away from low-income taxpayers towards high-income taxpayers. Increase the non-filler compliance program, strengthen reporting requirements for international income, use existing currency transaction reports to enforce cash income compliance, and increase reporting requirements for virtual or cryptocurrencies, as suggested by the Treasury Department's Inspector General. Allow employees who disclose tax evasion and abuse to use the protections of the False Claims Act and other whistleblower protections. The experts who reviewed these ideas estimated that if we implemented them, we could close the tax gap by 1/3 from 15% to 10%, bringing us closer to the tax gap in countries like the United Kingdom, 5.6%. That will produce another $2.3 trillion in net federal revenue, without imposing a single new tax. Targeted taxes on the financial sector, large corporations, and the top 1%. We can generate a whole lot of the remaining revenue we need for Medicare for All just by eliminating bad incentives in our current tax system and asking those who have done really well in the last few decades to pay their fair share. Let's start with the financial sector. It's been more than 10 years since the 2008 financial crisis, and while a lot of families are still dealing with the aftereffects, the financial sector is making record, eye-popping profits. Meanwhile, the risk of another financial crisis remains unacceptably high. By imposing targeted taxes and fees on financial firms, we can generate needed revenue and also make our financial system safer and more secure. For example, a small tax on financial transactions, 0.1% on the sale of bonds, stocks, or derivatives, would generate about $800 billion in revenue over the next 10 years. The tax would be assessed on and collected from financial firms, and would likely have little to no effect on most investors. Instead, according to experts, the tax could help decrease what Americans pay in fees for their investments and reduce the size of relatively unproductive parts of the financial sector. We can also impose a fee on big banks that encourages them to take on fewer liabilities and reduce the risk they pose to the financial system. A small fee that applies only to the 40 or so largest banks in the country would generate an additional $100 billion over the next 10 years, while making our financial system more safe and resilient. Next, we can make some basic changes to ensure that large corporations pay their fair share and to fix some fundamental problems with our current approach that actually encourage companies to shift jobs and investment overseas. These changes will generate an estimated $2.9 trillion over the next 10 years. For instance, our current tax system lets companies deduct the cost of certain investments they make in assets faster than those assets actually lose value. That means that if a company buys a machine for $1 million, it gets to deduct $1 million from its taxes that same year, even if the machine only loses $100,000 in value a year. Letting the company write off the extra $900,000 all at once is like giving them an interest-free loan from the government. That might be worth it if the company responded to this tax break by investing more in building out their businesses. But the data suggests this isn't happening because companies don't actually value these tax deferrals as much as policymakers assume. Companies are mostly making the same investments they would have made anyways, sometimes with small changes in timing, and getting a write-off in exchange. Some experts even suggest that accelerated expensing could induce less domestic investment, not more. That's why I'm proposing to get rid of this loophole. Under my plan, businesses will still write off the depreciation of their assets, they'll just do it in a way that more accurately reflects the actual loss in value. This would generate $1.25 trillion over 10 years. We can also stop giant multinational corporations from calling themselves American companies while sheltering their profits in foreign tax havens to avoid paying their share for American investments. Currently, a U.S. multinational corporation can make billions in profits and attribute it to a company it set up in a tax haven like the Cayman Islands, which has no corporate taxes. The Trump tax bill claimed to address that problem by creating a global minimum tax rate for corporations, but that minimum tax, the result of heavy lobbying by multinationals, is too low and easily gamed. While Trump and congressional Republicans claimed their minimum tax would keep companies from shifting profits to tax havens and limit offshoring, the opposite is happening. The current approach both encourages companies to shift their profits to tax havens and actually incentivizes American companies to outsource their operations overseas. That's why I'm proposing to institute a country-by-country minimum tax on foreign earnings of 35%, equal to a restored top corporate tax rate for U.S. firms, without permitting corporations to defer those payments. Under my plan, corporations would have to pay the difference between the minimum tax and the rate in the countries where they book their profits. For example, an American corporation booking $1 billion in profits in the Cayman Islands, taxed at 0% there, would need to pay the federal government a 35% tax rate, the difference between the new minimum rate 35%, and the foreign rate 0%, on the $1 billion in profits. My plan would also collect America's fair share of profits that foreign companies make by selling their products to Americans. Today, we have a global tax deficit. Companies that sell their goods abroad don't have to pay the extra taxes that they would have to pay if they were subject to a minimum effective tax rate in each country they operated in. Making U.S. firms pay a country-by-country minimum tax effectively collects their whole global tax deficit, but foreign companies should have to pay their fair share as well. That's why I'm proposing that the U.S. collect the fraction of this global tax deficit that corresponds to the percentage of that company's sales in the U.S. In other words, if a foreign company should owe an additional $1 billion in taxes, if it were subject to a country-by-country minimum tax, the U.S. would collect a fraction of that $1 billion based on the amount of sales that company made in the United States. Together, the country-by-country minimum tax and the taxation of foreign firms based on their domestic sales would result in an additional $1.65 trillion in revenue. Finally, we can raise another $3 trillion over 10 years by asking the top 1% of households in America to pay a little more. The tax burden on ultra-millionaires and billionaires is less than half that of working families in the United States. In 2019, the bottom 99% of families will pay 7.2% of their wealth in taxes, while the top 0.1% of households will pay just 3.2%. My ultra-millionaire tax, a 2-cent tax on the wealth of fortunes above $50 million, tackles this head-on. Under this tax, the top 0.1%, the wealthiest 75,000 Americans, would have to pitch in 2 cents for every dollar of net worth above $50 million and 3 cents for every dollar on net worth over $1 billion. With this version of the ultra-millionaire tax in place, the tax burden on the wealthiest households would increase from 3.2% to 4.3% of total wealth, better, but still below the 7.2% that the bottom 99% are projected to pay. Today, I'm going one step further. By asking billionaires to pitch in 6 cents on each dollar of net worth above $1 billion, we can raise an additional $1 trillion in revenue and further close the gap between what middle-class families pay as a percentage of their wealth and what the top 0.1% pay. Yes, billionaires will have to pay a little more, but they will still likely pay less than what they would earn just from putting their assets into an index fund and doing nothing. The average annual rate of return of the S&P 500 has regularly topped 10%. And billionaires have access to the kinds of fancy investment opportunities that can generate even higher returns on average. Put it this way, should we ask billionaires to pitch in an extra 3 cents on every dollar above $1 billion, or force middle-class families to bear another $1 trillion in healthcare costs? We can also change the way the government taxes investment income for the top 1%. Today, taxes are only assessed on capital gains when securities are sold. That means wealthy investors can put their money in the stock market, see it grow, and not pay a dime in taxes on those earnings unless or until it is taken out of the market. Under the current system, they can then pass along those shares to their heirs when they die, and their heirs will be able to pay even less when they choose to sell. I've already proposed closing that loophole for how capital gains are treated when shares are passed on to heirs. But we can go a step further. Under a mark-to-market system for the wealthiest 1% of households, we will tax capital gains income, excluding retirement accounts, annually, rather than at the time of sale, and raise the rates on capital gains to match the tax rates for labor income. Individuals would still only pay taxes on gains and could use current losses to offset future taxes. Under this system, investment income will no longer be treated differently than labor income for the top 1% of households. Ultra-millionaires and billionaires won't be able to earn income on giant fortunes year after year without paying a penny in taxes. And we can raise another $2 trillion over 10 years to pay for my Medicare For All plan. Immigration reform. I support immigration reform that's consistent with our values, including a pathway to citizenship for undocumented immigrants and expanded legal immigration consistent with my principles. That's not only the right thing to do, it also increases federal revenue we can dedicate to Medicare for All as new people come into the system and pay taxes. Based on CBO's analysis of the 2013 Comprehensive Immigration Reform Bill, experts project that immigration reform would generate an additional $400 billion in direct federal revenue. Reining in defense spending. Since the attacks of 9/11, the United States has appropriated $2 trillion to fund combat and counterterrorism operations around the world via the Overseas Contingency Operations Fund, or OCO. On average, the spending has amounted to $116 billion per year, and in total, an amount equivalent to nearly 10% of all federal discretionary spending over that same time period. Republicans, including the president's current chief of staff, and Democrats alike agree that OCO is a budget gimmick that masks the true impact of war spending. The emergency supplemental funding mechanism was never intended to fund the costs of long-scale, long-term operations outside of the normal appropriations process. And in recent years, OCO has also been used to fund so-called base requirements unrelated to the wars, outside of the Budget Control Act caps, in effect acting as a slush fund for increased Pentagon spending. And as everything from more F-35s to massive bombs never used in combat have migrated into the OCO account, the Department of Defense has been spared from having to prioritize or lie within its means. It's not just bad budgetary practice, it's wasteful spending. I've called out this slush fund for what it is. I've also called for an end to endless combat engagements in places like Afghanistan, Iraq, and Syria, and to responsibly bring our combat troops home from these nations. These open-ended commitments are not necessary to advance American foreign policy or counterterrorism interests. Their human cost has been staggering, and their financial cost has created a drag on our economy by diverting money better invested in critical domestic priorities. I've also called to reduce defense spending overall. The Pentagon budget will cost more this year than everything else in the discretionary budget put together. That's wrong, and it's unsustainable. We need to identify which programs actually benefit American security in the 21st century, and which programs merely line the pockets of defense contractors, then pull out a sharp knife and make some cuts. We can start by shutting down this slush fund and balancing with our overall defense priorities in the context of the actual defense budget. And as we end these wars, eliminating the Overseas Contingency Operations Fund and forcing the Pentagon to fund any such priorities through its regular budgetary process will provide $798 billion over the 10-year period relative to current spending levels. As I have said repeatedly, under my Medicare for All plan, costs will go up for the very wealthy and big corporations, and costs will go down for middle-class families. I will not sign a bill that violates these commitments. And as my plan to pay for Medicare for All makes clear, we can meet these commitments without a tax increase on the middle class, and, in fact, without any increase in income taxes at all. America's middle class is facing a crisis. For a generation, wages have remained largely flat while family costs have exploded. I've spent decades sounding the alarm about it. I'm running for president to fix it. That means doing whatever we can to reduce the overall strain on family budgets. Medicare for All can be a huge part of the solution. When fully implemented, my approach to Medicare for All would mark one of the greatest federal expansions of middle-class wealth in our history. And if Medicare for All can be financed without any new taxes on the middle class, and instead by asking giant corporations, the wealthy, and the well-connected to pay their fair share, that's exactly what we should do.